I would like to begin by providing a concise introduction to the highly anticipated 200th episode of the talk. In this particular session, we will have the unique opportunity to delve into a plethora of extraordinary concepts alongside the esteemed Dr. Zhou. Dr. Zhou was our special guest at the Masters of Medicine conference, which took place in October in the historic city of Arezzo. This conference attracted numerous professionals from all corners of the globe, making it an immensely rich and diverse gathering. It provided an enriching experience that allowed us to connect with a world that is often distant and rooted in ancient traditions. I had the pleasure of speaking with Dr. Zhou previously in 2018, and more recently after the exhilarating 150th episode of the Scienze Motori talk show with sportscience.com. ATS and I collaborated on a captivating documentary. This documentary gathered a wealth of valuable information that we have shared and explored throughout the years. Dr. Zhou's reputation as a distinguished doctor is undeniable as people from around the world seek his expertise. In fact, many individuals have provided remarkable testimonials regarding the therapeutic abilities he delivers through his unique approach to traditional Chinese medicine. In addition to his role as a distinguished doctor, Dr. Zhou is also a guardian of ancient medical knowledge that has been passed down through countless generations. This invaluable knowledge continues to be transmitted from master to apprentice in China. This aspect of Dr. Zhou's expertise is what makes it crucial for us to consider and understand the cultural foundations that underpin these concepts. It should be acknowledged that the task of spreading a universal and shared language is far from easy, and it remains uncertain if this will ever be achieved in the future. In recognition of this challenge, the ATS Institute has dedicated a department to the study and exploration of these topics. We firmly believe that understanding and embracing diverse cultural perspectives is an integral part of advancing scientific research. While it is unequivocally true that science is not subjective and does not adhere to democratic principles, it is equally crucial to acknowledge that science has no masters. Using the scientific method to expand our knowledge and gain a deeper understanding of phenomena and effects that continue to elude us is the essence of scientific progress. The purpose of this preface is to highlight that the subject matter we are addressing here represents a pinnacle, an extreme case that serves as a reference point. It is important to acknowledge that, just as in conventional Western medicine, there are diluted and unreliable approaches to complementary medicine. That being said, on the sportscience.com channel, we approach these topics with great interest due to their direct connection to health, prevention, and activities that are intricately linked to physical practices like Qigong. During our engaging conversation, we will explore the distinctive characteristics that continue to define and differentiate Western and Eastern approaches to therapy. However, it is worth noting that these approaches are gradually converging as we uncover common ground and shared knowledge. Moreover, we will also delve into the nature and significance of Qi, an element that is of great value to scientific research. This element serves as a dense and tangible entity, which ignites extensive scientific debates. Additionally, we will discuss the utilization of medicinal herbs in traditional Chinese medicine. This is an engrossing topic that garners widespread attention due to the diverse array of herbs available. Importantly, the manner in which these herbs are used varies greatly depending on the legal regulations within each country. As always, this episode of the talk on sportscience.com promises to be captivating as we delve into a myriad of intriguing subjects. Be sure to tune in and enjoy the episode. Benvenuti a un'altra grande puntata del talk scienzemotore.com.
I don't wanna go back. Give it to me, I'm on. You should just know that. Tell me what you wanna do. I don't wanna go back. Give it to me, I'm on. You should just know that. Hold tight, don't let go.
Welcome to the highly anticipated 200th episode of the Scienze Motori talk show with sportscience.com, where we are joined today by the esteemed and renowned Dr. Master Shifu Zhou. It is worth mentioning that our acquaintance with Dr. Zhou began back in 2018 during the special 150th episode of the Scienze Motori talk show. At that time, we had the privilege of opening up a whole new world of knowledge, exploring the realms of traditional Chinese medicine and the ancient wisdom that Dr. Zhou diligently preserves. This field of study continues to hold great significance, captivating the attention of countless researchers, scientists, healthcare professionals, physicians, and therapists who yearn to explore this unique approach to preventive medicine and therapy. Through this enlightening journey, we have been able to transcend geographical boundaries, expanding our understanding of subjects that are revolutionizing our overall perception of well-being. Today, we are granted another remarkable opportunity to delve deep into the fundamental principles and concepts that underpin traditional Chinese medicine, including the fascinating realm of herbal medicine. With immense pleasure, I extend my heartfelt welcome to Shifu, and I'd like to kick off this conversation by addressing one pivotal query. What sets Western medicine apart from traditional Chinese medicine?
Well, on this occasion, we will have a chance to explore this topic further. First of all, I would like to express my sincere gratitude to Giacomo Catalani for inviting me to ATS Institute and guest to this talk show. At his invitation, I came from China to Italy, mainly to discuss some health-related issues. When it comes to understanding the relationship between Western medicine and traditional Chinese medicine, it should be discussed in depth. Western medicine is a highly developed medical system and also quite ancient. However, in China, traditional Chinese medicine has a history of more than 5,000 years. The main difference between traditional Chinese medicine and Western medicine is that traditional Chinese medicine relies on a combination of observation, listening, questioning, and pulse diagnosis to tailor treatments to the individual's specific condition. Today's Western medicine typically relies on diagnostic tools and devices to ascertain the patient's condition, while traditional Chinese medicine uses the strengths of its holistic diagnostic approach, which include observation, listening, questioning, and pulse diagnosis. Each system has its own advantages and strengths. Indeed, Western medicine has advanced diagnostic capabilities. For example, it can detect internal problems that are not visible to the naked eye. Through technologies such as X-rays, CT, MRI, and blood tests, Western medicine can accurately assess a patient's condition. In traditional Chinese medicine, the history is based on observation, listening, questioning, and pulse diagnosis, which are used to make a differential diagnosis and prescribe a specific treatment tailored to the individual's condition. Traditional Chinese medicine often uses non-pharmacological methods and traditional techniques to address many health problems. Pain, such as headache, neck pain, chest pain, back pain, low back pain, knee joint pain, ankle joint pain, and hip pain, are very common among humans. In many of these cases, we could use the traditional and ancient Chinese therapy of acupuncture, for example, to solve many of these issues. Acupuncture is a very significant and ancient traditional therapeutic technique in China. However, it is good to know that in the field of acupuncture, there are various teachers, different schools of thought, and a wide and distinct range of techniques for treatment. In traditional Chinese medicine, we aim to eliminate or at least minimize the patient's pain, keep the duration of treatment relatively short, and achieve rapid efficacy. This type of treatment approach tends to be highly valued by patients. In the case of problems that affect the health of internal organs, it is equally useful to use traditional Chinese medicine remedies, which in this case differs from Western medicine in that this must be administered through injections, capsules, and tablets taken orally. Traditional Chinese medicine uses the fermentation of medicinal soups or decoctions, which are believed to have therapeutic effects. Some of these herbal remedies and recipes are handed down from generation to generation. There are remedies for numerous conditions, such as auto-inflammatory disease-induced fever, pain, debilitating gynecological conditions, migraines, and more. The methods used in traditional Chinese medicine are often very different from those used in Western medicine, where treatments may include the administration of injections even for chronic conditions. Conditions that, to achieve treatment goals, are often managed with heavy use of drugs, even for very prolonged periods. Traditional Chinese medicine takes a more gradual approach and is always geared toward avoiding a recurrence to medication, seeking rather to treat issues effectively with herbal remedies. Traditional Chinese medicine uses medicinal substances that grow naturally in the soil and are referred to as authentic medicinal herbs. These herbs grow in nature for many years, are harvested, cleaned, cut and processed, generally prepared through decoctions that make them suitable for treating patients. These herbaceous plants grow in nature, such as chrysanthemum or eucommia bark. This type of medicine has a wide range of applications. Some people claim that traditional Chinese medicine has a limited number of ingredients. So how can it treat all kinds of diseases? Actually, traditional Chinese medicine includes a huge variety of herbs, which include thousands of different types. The effectiveness of treatment in traditional Chinese medicine depends on the physician's ability and diagnostic accuracy. That is, on his or her ability to make an accurate diagnosis, create an accurate prescription, and achieve meaningful therapeutic results. In today's world, there are many complex health conditions, such as cancer or the development of nodules in the body, such as lung nodules. Western medicine often employs methods such as surgery, radiation, and chemotherapy to eliminate conditions such as cancer and nodules. In contrast, traditional Chinese medicine uses herbal remedies to balance the body and prevent further spread and development of such conditions. In this case, the aim is to gradually reduce the size of the nodules, thus achieving the treatment goal. Herein lies the difference between the two approaches. Traditional Chinese medicine is internal treatment method, but it is not limited to oral consumption. A therapy can, in fact, also be applied externally. It comes in various forms, including pills, powders, and ointments, and can be used in different ways. For example, some medicines can be fermented into a drinking decoction for adults. However, it may be difficult for infants or children to consume. These drugs may not be very palatable, so external application may be a good alternative method. Applying them externally without ingesting them can still produce healing effects.
Traditional Chinese medicine is based on the concept of energy blockages that occur along the meridians, and I would appreciate your insights on several aspects. Firstly, I am curious about your perspective on the origin and initiation of energy blockages. Furthermore, I'd like to know how practitioners select from the diverse range of traditional Chinese medicine techniques, such as acupressure, cupping, moxibustion, and acupuncture. Additionally, it would be insightful to understand which specific acupuncture technique is deemed most effective, as well as the role of Qi and vital energy in the treatment process.
Numerous factors related to the energetic blockage of meridians can lead the human organism to deep malaise. For example, limited joint mobility or restricted wrist movement could be due to a blockage of meridians at energy channels. Why do these blocks occur, even though you were fine just before? The human organism, when affected by moisture, for example, can develop blockages. A blockage means that a previously clear pathway is obstructed, and when a blockage occurs, it prevents the regular flow of qi and blood in the body. In traditional Chinese medicine, it is said that when qi and blood flow unimpeded, there is no pain, but when there is pain, it means the flow is obstructed. So how does traditional Chinese medicine treat blockages in our body? This depends on the accuracy of medical diagnosis. When the diagnosis is accurate, treatment and cure rates are much higher. To treat meridian energy blocks, traditional Chinese medicine uses various techniques, such as acupuncture and acupressure, a wide multiplicity of approaches to treatment that do not necessarily require drugs. The same techniques of acupuncture and acupressure allow excellent results in treatment and healing to be achieved. Therefore, how do you select an appropriate treatment for a specific disease? This depends on the individual case. For example, if a patient has suffered a fall and injury, this falls into the category of trauma, which may involve issues such as blood stasis and edema. Therefore, the first step is to use topical medicinal remedies to promote blood circulation, remove stasis, reduce inflammation, and eliminate pain. By dissipating blood stasis and reducing local swelling, the patient's condition can improve.
This particular technique of managing health, preventive care, medicine, and therapy is one that you uphold as a guardian at these different levels.
It's intriguing to comprehend how knowledge is transferred. It seems that you possess some exceptionally ancient books that I assume serve as your tools for studying and diving into these principles. Could you share how you acquired the knowledge, how you engage in study, and how you continue to deepen your understanding in this field?
My treatment methods are based on experience accumulated and passed down through generations in my family, along with the knowledge and teachings gathered from my masters over the years. If I had treated you yesterday, you would immediately feel the effectiveness. This is because of all the experience I have gathered over the years, and it is what we call Nian Fang, which means well-practiced therapeutic approach. For optimal treatment, it would be unwise to be hasty. We need to make a proper diagnosis and accurately identify the condition before proceeding with treatment. Nothing must be done hastily. If a patient tells us that he or she is experiencing a deep state of pain and we immediately start prescribing medication or performing acupuncture, this will not guarantee the best results. First, it is necessary to identify the cause. Let us take headache as an example. There are many types of headaches, such as ischemic headache, tension headache, headache caused by cervicalgia, and so on. We need to differentiate and diagnose the specific cause of the headache. Only then can our treatment be effective. How is it diagnosed? My therapeutic approach and objective examination is mainly based on palpation. Particularly for conditions that cause pain, I use palpation a lot. What does palpation mean? Palpation is the method by which I accurately determine the cause of the patient's symptoms, as described by the patient. Patients typically point to specific areas of pain, telling me, "It hurts here," or "It hurts there." Other patients describe their pain as widespread, involving an entire area. However, usually the pain comes from a specific body point or area. In many cases, the pain is due to nerve compression or fascial adhesions. With acupuncture, by intervening on specific points, we can achieve excellent results, relieving or completely eliminating pain and discomfort. Personally, I use medicines very sparingly in my treatments because they are not always necessary. The human organism has numerous switches and itself contains its own variety of remedies. This is traditional Chinese medicine, an approach that works on acupoints and meridians, mobilizing qi and blood, and balancing any imbalances in yin and yang, so as to generate a regulatory effect in the body. Acupoints can be considered a form of medicine. If you understand acupressure techniques, you can generate healing without the use of drugs. This is where differential diagnosis comes in. Thus, for certain circumstances such as cancer or lung nodules, Western medicine is highly advanced and can easily identify these conditions. Traditional Chinese medicine can also treat these conditions, but not all herbal remedies will be equally effective. Why? That is why, as healthcare providers, we must make an effort to study and observe patients carefully, pay attention to their expressions, breathing, and pulse diagnosis. There should be no incurable conditions in the world. Not always, but often, incurable conditions occur because of unclear or misdiagnosis. When the diagnosis is accurate, there is always an approach to deal with the disease. When I perform treatment, I don't always use acupuncture. I also use my fingers. And even by simply using my fingers, the patient's condition improves. For some specific conditions, such as bursitis or avascular necrosis of the femoral head, there may be blockages in the affected areas, and so these areas experience ischemia and oxygen deprivation. What does ischemia and oxygen deficiency mean? What is necrosis? Similar what happens to this finger. When you squeeze it, it turns white, and when you release it, it turns red. Blood moves to other areas, and when pressure is released, it returns. This return is not due to the return of blood alone. Rather, it is the result of the action of qi. Blood is the mother of qi. Qi governs the blood. Blood alone does not necessarily make a person healthy. True health comes from a balance of both, qi and blood in the body. An avascular necrosis of the femoral head or in any other area occurs when there is swelling and blockage in that specific body area. Similar to this situation, First it is red. If you wait a little longer, it will turn purple. Still later, the fingertip will become cold. After a few days, if blood and qi do not return to the flow, the tissue will go into necrosis, turning black. This means necrosis of the tissue. My treatment is aimed at eliminating blockages in the specific anatomical districts, not necessarily using acupuncture, also acupressure. Identifying the correct acupoints is equivalent to using the body's own medicine. This is a very safe, environmentally friendly approach, and the results of treatment are often obvious and rapid. By unlocking the areas that are compressed and compromised, the patient improves. Avoid taking many medications. Most people, when they experience pain, take medication. However, taking medications has potential side effects. Medications can heal some conditions, but they also have side effects on our bodies. When ingested, they must first pass through the gastrointestinal system, then the kidneys, and gradually enter the cells of our body. Therefore, in my treatment approach, I tend to minimize the use of drugs for patients and reduce their pain. Focusing on finding and stimulating the correct acupoints and stimulating the body toward natural self-healing. Long ago, learning traditional Chinese medicine was passed down only orally, from master to student. Today we have books. These books are old, very old. This book, for example, contains pictures that our teacher did not have when he was teaching. Explains that for this pain, when tendonitis is present, it is necessary to position the hand this way and not this other way. It contains excellent explanations. When we experience pain in a particular anatomical district, treatment may not need to be given in that specific location, but in another area. This is how it works. The human body is capable of very sophisticated movements that we need to learn to understand. We need to understand the motor control of the hand, for example, and all the underlying anatomy, how nerves and ligaments move. Because if there is a problem in one place, a neighboring one may also be affected. There is a ligament here. When there is compression or entrapment, problems can arise in this area. As I mentioned earlier, it is not always necessary to perform treatment exactly at the site of pain. We may have to treat a different area. A therapy based on acupressure may need no medication, no medicine. The human body has many acupoints, which means that it itself contains many forms of medicine. Identifying the correct acupoints to resolve a condition is like opening a door. If your door is locked, having the key allows you to open it. Without the key, you cannot open the door. In this way, we understand that in the human body, we need to use the right key in the right place to achieve the desired results. Thus, we achieve the purpose of treatment.
This episode is presented by ATS. Meet Master Shifu Dr. Joe. Get in touch with ATS Institute and get information. Write to info@institutoats.com.
I am grateful for your enlightening reply, Shifu. Just to clarify, when you mentioned your early years and how you began in the field of medicine, can you tell me about your personal experience? What path did you take, and how much experience did you gain before becoming skilled? This way, you were able to attain mastery of this knowledge and use it therapeutically. Thank you, Shifu.
I have a good background in the application of traditional Chinese medicine because my family has been engaged in Chinese medicine for many generations. My grandfather and father were both engaged in Chinese medicine. Then I studied under a great master who passed on unique and extraordinary knowledge. I began learning the principles of traditional Chinese medicine at a young age, focusing on both internal practices and the study of medicine. At that time, for various life reasons, I began to follow my master for my personal growth, and thus learned the first rudiments of Chinese medicine from the age of 5. I stayed with my master until the age of 20, and then left abroad to pursue my career. I have been officially practicing Chinese medicine for over 40 years. Chinese medicine is a field of study that requires continuous learning and exploration, constant daily study. If you are satisfied with the knowledge and skills you have learned, they will become obsolete during your lifetime. This practice requires constant dedication to study and much commitment. Many effective treatment methods are based on your own experience. How can we mature our experience? From daily interaction with patients, the study and analysis of various conditions and diseases, and the treatment methods we used. I could use a treatment technique that did not confer such obvious results. However, the effect of the same technique used in another condition could be very good. For example, if a patient has a shoulder problem, he should avoid wearing wool sweaters or clothes with tight necklines. It may be uncomfortable, as he or she may have limitations in using his or her hands or performing certain movements. But what is the problem? It may not be here. The source of the problem may be completely in another area. The blockage may involve another body district. I know this because of the experience I have accumulated over the years. This allows me to understand the pathology and treat my patients. You tell me it hurts you here, I say it hurts somewhere else, and here too. The patient says it hurts here, but when I treat that exact area, it doesn't hurt. What I know as a doctor is based on my experience, and based on that, I can figure out whether to use acupuncture or acupressure, tuina massage or other techniques. I have been studying traditional Chinese medicine for many years. I started when I was just over 5 years old, and even at that time, my teacher taught me that there is a need to learn something new every day. Chinese medicine and phytotherapy are different. Herbs are herbs. Chinese medicine is Chinese medicine. The use of medicinal herbs does not necessarily involve oral consumption, because many of these drugs can be applied locally, and the effectiveness of this application can be very helpful in relieving a patient's suffering, based on your experience. How is this root used? How is it combined with the others? Each individual herb has its own therapeutic significance, so how should they be used together to achieve the goal of curing the disease? First, it is necessary to determine the meaning of the pain. It could be caused by rheumatism, rheumatoid arthritis, or gout. It is necessary to understand. After understanding the origin of the disease, it is possible to proceed with treatment. Then we can achieve an optimal result. This is also true when we use acupressure-based therapy. It is always necessary to understand the origin of the condition before administering treatment so that it can produce the best result. Studying and using traditional Chinese medicine requires close attention to detail, willingness to overcome difficulties, and have an excellent memory. If your teacher tells you something, you must remember it. If I tell you something and you forgot, you will not be able to achieve excellent results. A very good memory is necessary. Then there is acupuncture. When using acupuncture, force and intensity must be correct. Too much force is not good. Too little force is not good. The best results come from using the right amount of force.
Shifu, I express my gratitude for your enlightening discussion about Chinese medicinal herbs and phytotherapy. This subject has immensely captured my attention, and I strongly believe that it holds great potential for in-depth exploration in Western regions. The intriguing aspect that captivates me is the unique essence found in the herbs cultivated in China, an essence that significantly distinguishes them from the approaches commonly encountered in the West. As we may have previously conversed, I am eagerly seeking your profound insights into the world of Chinese phytotherapy. My curiosity lies in comprehending how it is both utilized and integrated within therapeutic practices.
Traditional Chinese medicine offers a wide multiplicity of applications based on thousands of types of medicinal herbs. It all depends on how they are combined. It depends on their compatibility and the ability to combine these herbs. Again, the composition of Chinese medicines depends on the expertise of the doctor. It is not a matter of randomly taking any drug for treatment. Everything is based on correct prescription. There are many medicinal herbs. Selecting the best one among thousands is very important to achieve the desired effect. It is not a matter of randomly choosing a herb to treat a disease. It is not. Medicinal herbs are selected to treat certain conditions, but not all are useful for treating specific diseases. Some may be useful individually to treat a condition. Some may require a combination with other herbs, and some may require more with others. We call this compatibility. This is making an actual medicinal composition. Compounding a prescription is like building a house. Using only brick, cement, and steel bars, you cannot build a house. You need foundations. These must be placed according to the height and weight of the building. The same applies to traditional Chinese medicine. Should a patient weigh 100 kilograms, the dosage must be higher. In the event that it is a child, the dosage will be less. The application must be adaptable, not fixed. It's not that you get sick and you take some Chinese medicine. This is not the case. For example, if you are afflicted with conditions that are referred to in traditional Chinese medicine as wind and cold, it will be necessary to stimulate bodily sweating in order to expel the wind and dispel the cold. This might be the case similar to a common cold. On the other hand, if you have suffered an injury, sprain, strain, or bruise, you need to stimulate blood flow and stasis removal. If you have nodules in your system, you may need to use some animal drugs, such as millipede extract, that may be able to soften and dissipate the nodules. Chinese medicine is constantly evolving. There are thousands of different types of medicinal herbs capable of curing all human diseases. One medicine does not cure one disease, and each disease can be different. It all depends on how you use medicines available to you. This means studying Chinese medicine. Only by knowing the medicine can you cure the disease. Knowing how to use it, knowing its properties and functions, and most importantly, diagnosing what the person's real problem is. What kind of medicine does it need? What do I need to combine it with to make it work? Whether it is herbal, traditional medicine, or other extracts. Extracts are composed of many medicines, from which impurities are removed to retain only the pure essence. Some medicines are condensed into small extracts and produced through slow manufacturing processes. They are very valuable for healing, but also have an equally high cost. Transdermal administrations through patches and sprays that are applied to painful areas also exist in Western medicine to relieve pain. In traditional Chinese medicine, we use Chinese herbal pastes and apply them locally to relieve painful areas. This type of treatment also requires specific learning and a lot of practical experience gained by studying with experienced masters. Only through continuous and humble learning are we able to develop the best prescriptions to help more people in need. We should not think that a person is sick just because we see something in an X-ray. It may not be possible to get rid of that something, or it may not be possible to live with it. That doesn't mean it has to be removed immediately. Coexistence is possible. We can manage it with medication. If it doesn't grow, it will get smaller. If you treat it with medication and it continues to grow, you need to figure out what medication to use to control it. Fearless. This is Chinese medicine. In Western medicine, when an internal neoformation is detected, surgical removal is immediately indicated. In this case, they are two very different approaches to treatment. Western medicine has its strengths. Traditional Chinese medicine has its advantages. Both have their own strengths.
So what role does qi play during therapy? How can it improve the situation, and how can it assist the patient?
The practice of internal energy, Qi Gong, involves tapping into the essence of nature and the energy of heaven and earth. To be a good practitioner, I must be able to eliminate impurities and let the energy flow internally. The use of energy must always be combined with intention. What is intention? Intention is what I think about when I do therapy, a positive flow that allows me to accumulate positivity and expel impurities. Practicing Qi Gong means welcoming good things and eliminating bad things.
The qi is an important aspect that is frequently taught, mentioned, and discussed in relation to the entire universe. To promote good health and well-being, an individual must practice Qigong, which helps in achieving alignment of their mind, body, and spirit. I would like to know your opinion on the significance of attaining alignment of mind, body, and spirit, commonly referred to as holism in Western medicine. What are the specific advantages that arise from following a path where the organism is considered as a unified entity of the mind, body, and spirit?
We all have Qi, the life energy. Blood is the mother of Qi. Qi governs the blood. If there is not enough Qi, we can use acupuncture to stimulate the flow of Qi and tonify the body. By practicing Qi Gong, you can accumulate energy in your dantian, your energy reservoir, and use it to be transmitted to the patient in the therapeutic phase. This can help a lot to achieve the treatment goal, because Qi is crucial for the human organism. If you have a lot of Qi and deficient blood, there is an imbalance. The same applies in case you have abundant blood and deficient Qi. Blood is propelled by Qi, and Qi plays a central role in the human organism. When a person is very healthy, we say he is robust, has strong Qi and blood. When a person is weak, we say that his Qi and blood are deficient. A person who has no strength to talk is weak. When Qi is strong, his ability to talk is also strong. How then can we make our Qi and blood vigorous? Qi is something you cannot see or touch. Let's say there is a way in which you can see it. For example, your face is not normally red, but when you do something that makes you embarrassed or shy in front of many people, it reacts immediately instead. What is the reaction? Your face blushes. Your bottom doesn't turn red, though. The butt does not blush. And why does this happen? This is not easily understood, but this is the effect of Qi. If you feel embarrassed, the Qi moves the blood and the face blushes. Qi is something very subtle. Being alive means having Qi. Having only blood is not enough to survive.
I am grateful to you, Shifu, for yet another exceptional conversation. It is always a privilege to converse with you, and I eagerly look forward to future exchanges. I am confident that the insights you have shared today will greatly benefit many individuals. Those who choose to venture on the path in the medical field and in health will gain a better understanding of the intricate workings of the human body and the vast universe that surrounds us. Once again, I express my heartfelt thanks to you, Shifu, and eagerly anticipate our next meeting.
Thanks to you.
SportsScience.com is the #1 worldwide streaming platform for professional and certified training in sports and health fields. Gain access to hundreds of technical training sessions with the best international professionals, professors, and researchers in the industry. Become a certified professional and earn the official ATS and sports science diplomas and certificates. SportsScience.com, sponsored by ATS.